Hello everyone, my name is Elise Cushman. I'm one of the oncology dietitians at Norris Cancer Center, and today we're going to talk about sugar and cancer. We'll look at the relationship of sugar and cancer, what the recommendations are for sugar intake, what is sugar, where is it found, what are the best practices for eating. I just read all that. So we've all likely heard the phrase that sugar feeds cancer. And today we're going to dive into that relationship between sugar and cancer and hopefully help you decide if you will choose to include sugar in your diet, what types of sugar you will have, and how much. Also, we'll look at what the nutritional recommendations are for sugar intake. So there's certainly a lot of fear with just about everyone that I speak with regarding sugar and cancer and what they feel is safe to eat. There's a lot of information out there, and after a diagnosis of cancer, anxiety tends to be running high. Then you read somewhere or someone tells you, oh, don't eat that. It has sugar in it, and that'll feed your cancer. So many of the times when I see patients, they're not really even sure what to eat at this point. So what do we know is that 50 to 80% of cancer patients are malnourished upon diagnosis. So this can occur from a myriad of things like weight loss, or the form of loss of appetite, where the tumor is located, can have some impacts as far as chewing, swallowing abilities, digestion abilities, and then a higher resting metabolic rate tends to come with cancer. So that can also lead to unintentional weight loss. So we're going to start at looking at cancer on a cellular level and how the differences are between a cancer cell and a normal cell. And if you look at this slide, the slide on the left, you can see that normal cells have a very uniform appearance. And the picture on the right, cancer cells, they don't tend to have really any uniformity there. And how I like to tell everybody in a simple analogy is that if you're gonna, I like to break things into analogies, an apples to apples comparison, or in our case right here, TV to TV comparison. So looking closer at how a healthy cell and a cancer cell get their energy, a normal healthy cell has 2 insulin receptor sites on that cell. So go back to the 1950s, 60s, 70s, when you had these console-like television sets with rabbit ears. Hopefully everyone I'm talking about to knows what a rabbit ear is. So picture this television with the rabbit ears. And so those 2 little rabbit ears, those are your insulin receptor sites for the cell. And that's how cells pull in energy. Energy in its basic form is glucose. Every cell needs glucose on that basic level to provide energy. So those rabbit ears are the cells or the television's insulin's receptor sites. It's pretty simple, right? That's a normal cell. Then you go to the picture on the right. And that is a cancer cell. And that cancer cell has 46 insulin receptor sites. So that's why we have a mega antenna right there on that console television. And what this means is that cancer cells respond more than a normal cell does to insulin's ability to promote growth. So yes, on a very basic scale, or a very basic explanation, is that cancer thrives on glucose. But wait, what did I just say a few minutes ago? Every cell needs glucose in its simplest, or sugar in its simplest form, which is glucose, to feed cells. So looking at how we diagnose and how we look at cancer cells from the medical perspective is with a PET scan. And so if you ever wonder how these work, PET scans light up in the presence of cancer cells. So a PET scan of a cancer tumor shows the uptake of glucose from cancer cells. PET stands for positron emission tomography, and this is one method that is used to diagnose your cancer, to locate where your cancer is within the body. And active cells, such as cancer, use sugar as fuel quicker than normal cells. Go back to that last slide with that television analogy. Normal or benign cells and even scar tissue don't process fuel or energy that quickly as a cancer cell would. So before you have a PET scan, you're usually injected with, we're going to look at this little molecule down at the bottom right-hand side of your screen, and I'm going to butcher that, but it is fluorodeoxyglucose, or FDG is the abbreviation. We're going to abbreviate it just for everybody's sanity purposes. But the FDG combines a special type of sugar with a safe radioactive component to produce a radioactive tracer within your body. So cancer cells absorb a greater amount of the FDG than normal cells would, and when the snapshot or the picture or the image of the body is taken, the radioactive tracer in the FDG lights up. And that's where, if you're looking at the bottom left of your screen, you can see the tumors that are lighting up because these cells have taken up that energy, or that energy faster than the other healthy cells does. So does this mean that sugar feeds cancer? So while the supporters of the Sugar Feeds Cancer camp use this to add more support to their claim, recall though, sugar feeds all the cells within the body. So research continues to look for a connection between sugar and cancer. And what the research has shown us is that in certain conditions, limiting carbohydrate intake can slow tumor growth. And this has been looked at in brain cancers. Specifically, a ketogenic diet has been looked at, and that ketogenic diet reduces healthy and added sugars. The cancers that it has been looked or investigated in is advanced breast cancers and prostate cancers, and also brain, most specifically brain. However, the majority of this research does look at a very low carbohydrate diet in a setting of undergoing chemotherapy and or radiation at the same time as following the diet. So in most of these studies, the patients were following this diet for 6 to 8 weeks, again, while on treatment. And a very low carbohydrate diet was being followed. And this is about 20 grams or less of carbohydrate a day. And diving into this further can easily warrant a whole nother topic discussion later. But in sort of nuts and bolts of it, looking at the very low carbohydrate diet or ketogenic diet and what we know about it, unfortunately, we've not seen what happens in study, or there hasn't been enough studies that have looked at what happens after completion of treatment and when patients continue to follow a ketogenic diet. But what we do know is that this lifestyle is very difficult to maintain. Despite this, sugar can certainly raise anxiety. And then circling back to what we do know is that all cells within the body require sugar in its simplest form, otherwise known as glucose, to fuel cells. Healthy or so they're healthy or cancerous. Every cell needs glucose. But again, what I mentioned before is cancerous cells have more insulin receptor sites than normal cells. So again, thinking back to that television example with the rabbit ears. When people hear that sugar feeds cancer, some will wipe out all carbohydrate-containing foods. And in the setting of cancer, this can actually put more stress not only on the body, but also the mind of the patient. And then also the caregivers in the family. Within the body, stress can actually increase insulin, which may lead to higher blood glucose levels and also suppress immune function. During treatment, a couple of things occur. And this is what I tell everyone that I see, is that brain and belly no longer talk. So the signal of hunger usually isn't there. Some patients will tell me, oh, I heard my stomach rumbling, but I wasn't hungry, but I hadn't eaten in 6 hours. So things to think about. Chemotherapy also targets quickly dividing cells. For example, this would be cancer cells, but in actuality, you have healthy dividing cells all along your gastrointestinal tract. So tip of your nose to the bottom of your anus. These cells, on average, live about 2 weeks or less. This is a pretty harsh environment, very high turnover rate. So all these reactions within the body may reduce the possible benefit, if there is any, that eliminating sugar from the diet might offer. If you'd like to look into clinical trials, I definitely recommend you check out the CDC's webpage. You can go onto the NIH CDC clinical trials link on this PowerPoint, and that should take you directly to that link. When I did a search for cancer and the ketogenic diet, it generated 46 studies. However, some of these were terminated due to lack of participants. Some were pediatric, some were for polycystic ovary syndrome, which is not a cancer state. The wonderful thing about this site is that all these studies are publicly and privately funded throughout the world. So this is a great comprehensive database to get more information and to see if there are ongoing studies for particular cancer diagnosis. Many institutions have released statements regarding sugar. The Mayo Clinic formally states that sugar doesn't make cancer grow faster. The Oncology Nutrition Dietetic Practice Group of the Academy of the Nutrition and Dietetics says that basically much research shows that it is sugar's relationship to higher insulin levels and related growth factors that may influence cancer cell growth the most and increase other and increases the risk of other chronic diseases. The American Institute for Cancer Research shows that sugar itself is not the root cause of cancer, but it can indirectly lead to increased cancer risk if excess consumption of sugar foods leads to being overweight. So this is a really big pressing question. Do you remove all sugar from your diet? And I firmly believe that that's not necessarily the answer. Despite what the internet says, and some alternative cancer care practitioners say, well, we just saw too that there are some clinical trials looking at the relationship of a very low carbohydrate diet in cancer treatment centers and settings that are trying to learn more about it. We don't really have enough information. So far, the information we do have for brain cancers and some lung and some breast cancers have evaluated decreasing overall glucose intake. Notice I didn't say removing sugar, I said decreasing overall glucose intake. So does this mean that you need to follow a ketogenic diet? That's a question that's not black and white to answer. Ketogenic diets are very strict and very, very low carbohydrate. And if you are interested in following one, most certainly talk to your oncology team and make sure there is a dietitian on board on that team, because she or he will be really the one who guides you through the hurdles of everything that goes with the diet. So next we'll review the nutritional recommendations from the American Institute of Cancer Research and the World Cancer Research Fund International, and dive deeper into these recommendations, specifically the first two recommendations, which is the limit consumption of energy-dense foods and avoid sugary drinks and eat mostly plant-based foods. I'll let you read the rest of them, but these are great tips in the primary recommendations. So turning the focus to the first recommendation, to limit the consumption of energy-dense foods. We're going to dissect this further. Energy-dense or calorically dense foods typically mean processed foods in our country. The average American consumes about 150 to 170 pounds of sugar in a year. The American Heart Association recommends that men consume no more than 36 grams of added sugar per day, and that women consume no more than 25 grams of added sugar per day. And this translates to, oh there, now my slide is working. Thank you for being patient. To 9 teaspoons a day for men is what the 36 grams is, and then 6 teaspoons a day for women. All right, my slide did not work, so bear with me. There we go. All right, so 1 teaspoon of sugar is about, we round down, 4 grams of sugar, or 16 calories. Oh. There we go. So, as a dietitian and a foodie, I'm all about puns and analysis and puns and comparisons and breaking down foods to compare to make it simpler. So I always break down things to apples comparison as best as I can. So we're gonna look at these commonly consumed drinks: a 12-ounce regular soda, a grand mocha, and a glass of milk. And then also to an 8-ounce oral nutritional supplement. So your standard one that's on this shelf. Most of my patients that I talk with are drinking like an Ensure or Boost or Carnation Instant Breakfast, something like that. The soda contains 39 grams of added sugar, which translates to really 39 grams of sugar. The grand mocha contains 35. Sorry, the soda contains 39, not 35. The grand mocha contains 35 grams of sugar, and definitely it depends on where you get your information on the internet. I'm not a typical Starbucks patron. I don't do caffeine, so that's just what I'm finding on the online. An 8-ounce glass of milk actually has 12 grams of carbohydrates and 11 grams of total sugar, which is in the form of lactose. And then the 8-ounce oral nutritional supplement has about 33 grams of sugar, or 32 grams of carbohydrate, or 18 grams of sugar. So again, breaking this down, 18 grams would be about 4.5 teaspoons of sugar in that. I'll let you collectively do the math on the soda and the grand mocha and things like that. But it's just to keep in mind where added sugars can definitely infiltrate into your day and how you can go about on reducing those. So just looking at the ingredients in these items, what I try to teach anyone that I work with is that when you look at an ingredient label, you want to, one, have it simplified. If you can't pronounce the ingredient, you probably shouldn't be ingesting it. And then more often than not, the more processed the product is, the not as healthy as it is for you. So just looking at the soda and how they label ingredients on a nutrition label or a product is basically by percentage. So like, for instance, the soda, the primary ingredient is going to have more carbonated water than anything, but then high fructose corn syrup, the caramel coloring, the caffeine, so everything just goes down in the amount of quantity. And looking at these four, if I'm going to have to pick one, I'm going to say milk. Milk is a nice, simple, well-rounded food product, for lack of a better word. Milk has protein, carbohydrate, and fat in it. in the scale of things, it's going to provide more benefit than most, because it is nicely well-rounded like that. We could get into a discussion of more, or breaking down further the ingredients. I think I've hit the highlights there. That could also be another topic but not for today. So what is added sugar? When you look at an ingredient level, which is different than the nutrition label, sugar can come in all forms that aren't exactly clear-cut and spelled as sugar. So this is just a great example of some of the items that you may see pop up on an ingredient label that you may not have known that were sugar. It's not always brown sugar, molasses, honey, those types of ingredients. It's maltodextrin, it's maltose and fructose, those types of things. Those still count as sugar. And then too, and what's in a label? When you're looking at the label too, we're trying to simplify, or maybe oversimplify packages now, where they have stuff on the front as far as how much is a serving, what it offers in a serving as far as whole grains and calories, fat, that sort of thing. To me, go straight to the source. Flip the container over, look at the ingredients, look at the nutrition facts label, which they've changed. I believe they changed in February, maybe, of 2020. So the ingredient label may not necessarily be underneath the nutrition facts. It may be beside it. It may be around the other side of the product, but they're usually pretty close together. The nutrition label breaks down all the information. It gives you the serving size, the calories per the serving size, the fat, the sodium, the carbohydrate, and the protein, fiber, etc. The new nutrition labels, which you'll see on the far right, breaks it down a smidge differently. The daily value is now on the left-hand side of the label, and it just tries to simplify it some. They're basically the same. It also adds, which is very nice, added sugars, vitamin D, and potassium. So I have worked with patients that have to limit or monitor their potassium intake due to their kidney health. So that's very helpful, because potassium was not on a lot of stuff. But again, going back to milk as an example, though neither of these labels are milk, it would have the total carbohydrates is 12 grams. The total fiber would be 0. Sugars would be 12, but again, these sugars are lactose. So it's found within the milk. It's not added in there. And it would have 0 added sugars. So now let's look at the cost benefit of reducing added sugars in your diet and what those may be. Is there really a downside or an upside to cutting added sugars out of your diet? Well, your waistline may thank you, and likely, because you'll drop some pounds, likely some body fat. Your triglyceride levels tend to decrease when you start to reduce your added sugar intake. Let that also be a sort of a light bulb in your brain to ask yourself, when was my last lipid panel? Because that would be something to definitely look at. So go back to your primary doctor on that one. Also, your dentist will notice this. So it may be that your dental exams are more simple and easy and don't take as long because you don't have as many dental caries happening. But wait, if you know anything about nutrition and food, there is glucose or carbohydrates in whole grains, fruits, vegetables, and legumes. Am I telling you to stop eating these? No. It's a big, loud no. These foods contain fiber, vitamins, minerals, phytonutrients, sometimes fat and protein. And they're healthy. These are what we consider, what we want on your plate and in your day. We also know that these are the very same foods that help reduce chronic inflammation, support the immune system, and reduce your risk of cancer and cancer recurrence. Are there other things that you can do that can be beneficial? So first and foremost, look at your plate. Plant-based foods and physical activity play huge roles for stabilizing blood glucose levels. So I also always tell people, and I just sort of recently coined this phrase, or found this phrase, I should say, is carbohydrates should never be eaten naked. And I get giggles, especially with my audience of 10 years and younger, but never eat them alone or on an empty stomach. So a naked carbohydrate would just be like an apple, for instance. You want to put with that apple some almond butter or protein butter or some nuts, because that's good. Sorry, I said protein butter, peanut butter. That's going to add fat and protein and slow down how quickly your body breaks down the apple, so that you don't have this rise and fall in blood glucose levels. You're going to have a nice even sort of plateau, and then it'll scale down. So that's what you want to look for. So adding fat, fiber to your carbohydrate and protein, slow down the stomach emptying, lower the overall glycemic index of the snack or the meal, and protein helps to lower the blood, avoid lows as far as blood sugar levels go, and it also helps to control the appetite, because it takes fat and protein longer to be broken down than it does a carbohydrate. So reducing your added sugar intake by trimming out sodas. And I include diet sodas in this as well. Overall, what diet sodas do as far as the brain chemistry goes and tricking your brain into thinking you're hungry and things like that, there's not a great benefit. Trimming out candy and other sources of sugar that really don't have a nutritional impact. And then obtaining and maintaining a healthy weight, limiting excessive carbohydrates, and this would include simple carbohydrates, and just knowing too that not all carbohydrates are created equally. This leads us to a little glance into the glycemic index. And the glycemic index is a number out of 100, and it indicates how quickly a carbohydrate food or an ingredient is absorbed within the body as glucose. The lower the number, the more stable your blood glucose levels should be after eating this food. But it's important to note that when looking at the glycemic index, the number that's calculated is just looking at this one ingredient alone. Additional fiber, protein, and fat, the rate of absorption, all of these are factors that play into this and how quickly that food product is released into the bloodstream. So when they came up with this number, they checked, they would feed subjects a specific amount of this. So we're going to say carrots, for example. They monitored 50 grams of carrots that were eaten. And so for reference, 28 grams is an ounce. So it's not quite 2 ounces. They checked the blood sugars every 15 minutes. And then that's how they developed where things fall within the glycemic index. So just to note too, portion sizes of this can be misleading. Some people will think, oh, well, an orange, for instance, 2 ounces of an orange is not very much. Whereas 2 ounces of potato chip, that could be like the little travel bags. So just keeping that in mind. And then going back to our example of carrots have a moderately high glycemic index, but you'd have to eat several pounds in one sitting to have a significant increase in blood sugar. And so when you correct the glycemic index for carrots for a serving size, it gives a glycemic load that's actually very low. And carrots actually have very little effect on blood sugar levels in the amount that you would typically eat. Also, let's be very forthcoming. Who's going to sit down and eat carrots naked or alone? You're probably going to pair those carrots with something, whether it's peanut butter, cottage cheese, something like that, or with, as a side for your meal, which is hopefully got some protein and other vegetables in it. So research suggests that the benefits of a low glycemic diet for many chronic diseases is very, very beneficial. However, studies looking at glycemic index diet and cancer tend to be mixed. So, diving a little further, risk factors for elevated insulin levels. So, as we age, what we do know is that most often people become more insulin sensitive. Also, too, as we age, our movements tend to decline. So a lot of this comes into, is there a predisposing history or family history of diabetes that would make you, more insulin sensitive? Then lifestyle plays a huge factor. Physical activity improves the ability of cells to use glucose, and this can help keep blood sugar levels in a lower, more normal range. Helps to clear excess blood sugar that would otherwise trigger insulin production. And we also know that weight is a big factor, particularly abdominal weight. So overweight and obesity, fat around the abdomen, is actually slower in processing the insulin signal and slower in clearing blood sugar, which can lead to insulin resistance and also then lead to metabolic syndrome. So this slide just gives a good overall view of what metabolic syndrome is. And it happens when the body can no longer compensate and it makes more insulin, or can't make more insulin. Beta cells are the insulin-making cells of the pancreas, and eventually they can't keep up with the demand for insulin. This signals the end of insulin resistance and the transition to type 2 diabetes. The risk of progression from metabolic syndrome into full-blown diabetes can be decreased with weight loss, a healthy diet, and increased physical activity. So these 3 things play such a huge role in so many facets of health. So that is the end of our discussion. Feel free, if you have any questions, to reach out. We have 3, almost 4, cancer dietitians within the Cancer Center, and we're here to serve patients with a cancer diagnosis. There's a lot of information out there. Not all of it is true or evidence-based, and that's where we can be one of the resources or the tools in your toolbox to help navigating those murky, confusing, overwhelming waters with a cancer diagnosis that tends to happen. So that's all I have for today, and thank you for tuning in.